Well, good evening and welcome to the COVID-19 pandemic update. I'm Kayode Okikilu. First, the highlights. Delta State Health Authorities debunk claims of vaccine unavailability. And the Director General of the National Agency for the Control of AIDS, NACA, says infrastructure and services diverted to COVID-19 management are now returning to HIV and AIDS care. The Health Ministry in Israel says almost 40% of coronavirus patients in the country are children under 12 years, as the WHO asks wealthier countries with high vaccination rates to share doses with poorer countries. Well, thank you for joining us on the program as we bring you all the vital information you need to know about the COVID-19 response both in Nigeria and beyond. But first, let's bring you the latest COVID-19 trends.
52 additional persons in Nigeria have tested positive for COVID-19 in the last 24 hours. According to the Nigeria Center for Disease Control, the latest figures were reported from 7 states and indicate a rise from the figures reported 24 hours earlier. Rivers had 20 cases, Lagos followed with 15 cases, Plateau and Jigawa had 8 and 6 cases, Delta, Gombe and Kaduna states had 1 case each. This report contains backlogs of confirmed cases from Lagos. No new cases were reported from Edo and Sokoto states. The total caseload in Nigeria has risen to 213,677. 19 more people were discharged, bringing the total number of recoveries to 206,797. There were no additional deaths from COVID-19 complications reported in the last 24 hours, keeping the total number of deaths to 2,974. There are more than 3,000 people on admission, while over 3.47 million samples have been tested. The latest update from the National Primary Healthcare Development Agency shows that over 6.1 million Nigerians have received a first shot of the COVID-19 vaccine, while over 3.4 million persons have been fully vaccinated. Globally, more than 7.4 billion vaccines have been administered. In Africa, there are more than 8.5 million confirmed cases and over 221 deaths recorded across countries on the continent. More than 258 million people all over the world have contracted COVID-19, while deaths are over 5.1 million.
Health officials in Delta State are refuting claims that some persons were unable to get a second dose of the COVID-19 vaccine owing to unavailability of the vaccines. They explained that some residents insist on having a particular type of the vaccine which may have been reserved as a second dose for persons who have taken the first dose of that particular brand. They are asking for sensitization in this regard to enlighten the people on the efficiency of both the Moderna and AstraZeneca vaccines, especially as the Yuletide draws near. Meanwhile, a visit to some designated vaccination centers in Asaba, the state capital, shows some residents receiving their jabs.
We have AstraZeneca, we have Moderna. There was a time we had, we were expecting Pfizer, but we didn't receive. So we've been jabbing AZ, AstraZeneca, and Moderna. So, but of 2-3 weeks back, we run short of Moderna. So, and it's as if some persons who want to even travel want to tell you, this is the type I want. But by the time we look at their inquest from the embassy, we now pointed that even AstraZeneca is also there. But it's as if they seem to have a mindset on a particular one. So we make them know they are both internationally accepted. Part of what the partners did, was a couple of months back, was to see how they could encourage us, give us some fun, make calls to persons who might have forgotten their dates. So some of them come in second jab. Then some too, based on the sensitization we have been doing or carrying out, they also come for the first jab. So the statistics are not with me now, but we have a good number of second jab coming after that period of calls that we made to some of them.
there is enough vaccines in Delta State. In fact, as I'm talking to you, we have just in our age more than 2,000 doses. We're looking for even people to give. So we have enough vaccines in all our health facilities, both private and public. There's enough vaccines, and we're even having some sites, just as I've told you before, some vaccination sites where you have crowds, like ShopRites and marketplaces. So we have enough vaccines.
So the federal government and states across the country continue to upscale vaccination with a flag off of mass vaccination campaigns. And the aim is simple, to get a handle on this pandemic. But how feasible is it to end the pandemic in the country by 2022? A target which was recently revealed by the incident commander of the Presidential Steering Committee, Dr. Mukhtar Mohammed. Well, let's take a look at where we are today, where we plan to be, and how to get there. We're joined on the program by Dr. Olukemi Olugbade. She is a public health physician who's done substantial research into the pandemic. She joins us via Zoom from Ife in Osun State. It's good to have you, Dr. Olugbade. So let me just begin from that target. So we've set a target, it would seem, but we need to fully understand where we are first, so we know how to get to where we want to be. Over the past 7 days, we've had an average of 50 cases. And I just wonder for you, I mean, you see things differently because you're a scientist as well and a public health physician. What's your interpretation of the recent infection rates? You know, we had 52, 36, 57, 45, 23, 61, and 82 just in the past 7 days with an average of 50. So how do you interpret that?
Okay, thank you very much for your question. And so the thing is, like you said, the average number of cases over the last 1 week has been about 50. And compared to the number of cases over the last 6 weeks, it actually shows that there's a reduction in the number . It also shows that there's still transmission ongoing. And so this is the area that needs to be tackled as soon as possible. And the ways that this can happen is for everyone in the country to take it as a shared responsibility. It's not just the responsibility of probably the local government or the state government or the federal government or NCDC or the Public Health Institute. It's the responsibility of every citizen. The protocols are there: use of face mask, hand washing, physical distancing, avoiding large crowds, and then vaccination. Vaccination right now is the way to go because it has been proven, it has shown that vaccination will reduce the risk of severe disease, it will reduce hospitalization, and it will also reduce the risk of death. So this is the current focus of the government, of the country, and then even all countries globally.
You know, we lost you for a moment earlier on in your response. And, you know, on the back of that question, I'd just like to know, you know, scientifically, I mean, looking at the epidemiology of things, really, does this show that we are now maybe closer to a fourth wave, or we're just seeing this taper down and we'll just cruise on from here?
So with the epidemiologic trend and the epidemiologic curves that have been projected over the last few weeks, over the last 45 weeks in the country, there is a downward trend which is reassuring. But like I said earlier, there are still cases being detected, and that means there's still ongoing transmission. And this is what we need to interrupt. Now, in making sure that that interruption is done, vaccination is the next step that we need to focus on, and also continuous health education, continuous health promotion, continuous advocacy, and community engagement. So it is feasible for the pandemic as projected to taper down over the next few months, but that will only be if we continuously improve our vaccination coverage and improve collaboration to reduce transmission. Even though our statistics shows that a lot of people have taken their first dose, if you comparatively, the number of persons who have taken both doses is still small compared to the expected projections. So that is where we need to focus our attention on now, for more people to get their second dose, and then for those who have not even been vaccinated at all, to get vaccinated as soon as possible.
And, risk communication is a big deal. I mean, this era of pandemic, in fact, to combat any public health disease, as it were. So if you could paint a picture of this fourth wave for us, what is it likely to look like? Is it going to be like a fourth wave as we've seen the third wave, or it's just going to be merely a splash on the back of the natural immunity we've seen and some of the vaccine-induced immunity that we should get from at least the 5 million doses that have been administered?
So right now, the public health institutes and the public health agencies and every public health official in Nigeria is working towards the prevention of a fourth wave, because as much as possible, we want to reduce the risk of infection, the risk of transmission, reduce hospitalization, and reduce all forms of morbidity and mortality. So prevention is our focus now. And the focus for prevention, like I said before, health education, specific protection, which is vaccination, and then continuous community engagement and risk communication. So this we would continue. But if there will be a fourth wave, it is not likely to be different from the third, because we have seen the same pattern since the third wave began. The peaks were during the first wave and the middle of the second wave. And over time, especially when vaccination was introduced, we saw that the wave started tapering down. And we hope, with all the work that is being done across the country, that the wave will continue to taper down until hopefully the outbreak ends. So
on a
that's
final
our
note,
hope and our expectation, and what
sorry, you can land on that. Okay, I mean, certainly that's what we all look forward to, but there's that target which has been set by the end of 2022. The PSC is looking forward to ending this pandemic in Nigeria. I know that we've set ambitious targets in the past regarding, testing and the rest. So this is not a first. But really, how achievable is this? What do we need to do or start doing now, if we've not started already, to achieve that very ambitious goal?
Okay, so I'm very positive and also very hopeful. We've been able to eradicate guinea worm in Nigeria. We've been certified polio-free. There are also other ongoing pandemics other ongoing outbreaks and epidemics that are under control, like Lassa fever, cholera, and then I don't think it will be different with COVID-19. And so far, the country has been doing well in achieving these targets. So we're hopeful that working together, which is key, collaboration across all sectors, education, health, security, is very important for interrupting the wave of transmission and ending the pandemic. 2022, yes, lofty, but at the same time, I believe it is feasible.
I think we'll just end on that very optimistic note. It's been a pleasure speaking with you, Dr. Olukemi Olugbade, who's a public health physician. We're rooting for you, definitely, for the scientists as well. And we wish you the very best. Thank you.
Thank you, too. Bye.
So we're going to break now. And when we return, the pandemic has been having a huge effect on a global epidemic. You wonder what that is? We'll tell you this, as well as the situation in UK after this break. To join us again. Welcome back. Earlier this month, UNAIDS raised the alarm that there could be a rise in HIV infections and AIDS-related deaths in West and Central Africa in a couple of years due to the disruption suffered in health services as a result of COVID-19. And today, the National AIDS and Sexually Transmitted Infections Control Program under the Federal Ministry of Health has revealed that at least 150,000 children are living with HIV and AIDS in Nigeria, with more than 40% said to be unable to access treatment. At a press briefing in Abuja, the program coordinator, Dr. Akudo Ekpazu, and other stakeholders, including the Director General of the National Agency for the Control of AIDS, NACA, as well as the country director of UNAIDS, raised concern on growing inequality in accessing treatment for HIV and AIDS.
And on the impact of COVID-19 on access to antiretrovirals by people who are infected with HIV, that impact was more pronounced during the lockdown at the beginning. It's no longer there now because there is mobility and people have access to our facilities. Those facilities, some of them were serving as COVID isolation centers. They are freed now, so services have been provided. So that thing has changed drastically, and now we're seeing improvement in terms of uptake, people taking this medication. In terms of operation, similarly, operation also was hard at the beginning because all the infrastructures we had for HIV were made available for COVID-19 response.
It's best to see that COVID-19 has been an opportunity for Nigeria. We need to be clear on that. Opportunity to find new ways to accelerate our regular program. Okay, as I had pointed out, more people have been put on treatment in Nigeria during COVID-19 period than any other country in the world. So that's number one. Number two, on the resource level, Global Fund has been able to make tremendous amount of money available to Nigeria to fight COVID through NACA.
Outside Nigeria now, it looks like the UK may be getting it right with its COVID-19 response as the country appears to be cruising into the Christmas holiday with cases expected to stay fairly flat, while other European countries like Germany, Netherlands, Slovakia, Czech Republic are reporting all-time highs. In fact, Europe is once again the epicenter of the pandemic, with 60% of the world's cases and deaths recorded there. Well, the WHO DG has warned against a false sense of security, and it may come across as though that message is for the UK. But what are we really looking at here? Our Channels TV correspondent in London, Juliana Olayinka, joins us now for more insight into this. Juliana, it's great to see you. It appears as though the UK is looking like it's shielded from this recent spike we're seeing across Europe. Might be a good time to copy notes. So tell us, how is this happening?
Good evening, Kaide. Well, it's an interesting way to put it, but I've got to make it clear that we're not out of the woods just yet. Yes, to go back and give it some context, as you were saying, Europe is now once again the epicenter of COVID-19. Of course, the World Health Organization was speaking a couple of hours ago, talking about the fact that, yes, 60% of global deaths last week were in Western Europe. Most of the cases that we are seeing are taking place in some parts of Western Europe. As you will remember, Britain was the first country in the world to roll out the vaccine. There was a huge spat at the beginning of the year between the European Union and AstraZeneca, and orders or provisional contracts that seem to have been ripped apart. That delayed some of the vaccines. Then, of course, we had a pretty outlandish statement from the French President Emmanuel Macron about the AstraZeneca vaccine that spilled some vaccine hesitancy. So it's been rather slow with the uptick there. I believe vaccine hesitancy is still a major issue on that continent. Going back to the UK, Britain was one of the first countries in Europe to fully open its doors in the summer. So during the summer months when lots of Europe was still locked down, Britain was out, we did see a huge peak in the number of positive infections, but most people were spending time outdoors. And we know from the guidance from the World Health Organization is that COVID-19 is less likely to be spread when you're in an outdoor environment. So even though, yes, we may not have some of the high hospitalizations, high death rates that we're seeing in Europe, they're still pretty bad here. I've got the latest figure for the Office for National Statistics showing that in the last 24 hours, there are 165 deaths, 42,484 positive cases in the UK. We've been over this 40,000 mark for such a long time. Britain does have the highest death rate of COVID in Europe, still has that high death rate, one of the highest death rates in the world. But it does appear as if some people have become so immune to that here in Britain because we've had these high death rates for such a long time.
And, you know, it's quite ironic then that some are actually projecting that the UK might be first to go from pandemic to endemic. I wonder, how is this even a consideration?
I'm not sure who's considering that, Kaido. That's certainly not the news lines coming out of the UK. But, of course, you know, going back to the successful vaccination rollout, I think that's probably one of the only successes the British government can talk about. 9 in 10 people over the age of 12 have received 2 vaccines. About 80% of people have received at least 1 dose of the vaccine. 15 million booster vaccinations have been rolled out. So this is your 3rd shot of either one of the vaccines that are available here in the UK. So it's a good rate. Of course, there was a little bit of controversy about children in school being offered a jab, but it does appear as if the uptick is, you know, is being taken up. So people are following the government guidelines. I've got to say, anybody in the UK, especially our viewers in the UK, you will start to see now that if you're being invited to an event and it is in a closed space, people are asking you to take a lateral flow test, which you can take and you can get the results back within 15 minutes or so to make sure you can go into a venue. People are asking people to wear masks when you're in a cinema. So yes, so we're definitely not out of the woods just yet. But I think the fact that we started our vaccination program so early and the fact that most British people have taken up the vaccine is paying its dividends, clearly.
You know, it was the Secretary for Education, Nadeem Zahawi, who made that statement that, you know, it might actually be the first country to move from pandemic to endemic. But, Juliana, we're winding down now. It's just about a month to Christmas, and with that comes winter, when experts say flu and COVID spread more easily. So what's it looking like? Because flu and COVID-19 don't go well together.
No, they don't go well together. And of course, Kaide, you'll know that the NHS, particularly at this time of the year, is always under so much strain. There's been millions of pounds, in fact, billions of pounds put into the NHS to make sure there are extra staff to be on hand, to be able to help with patients. But yet again, if you go back to the data, even though we are still seeing a rather high number of people testing positive of COVID-19, we're not seeing that many people being hospitalised. There are some experts that are even saying the majority of the deaths that we're seeing in the UK, particularly over the past 2 or 3 months, are from the unvaccinated community, because there are only a few people that aren't vaccinated. It isn't leading to those hospitalisations. So I believe the Health Secretary, Sajid Javid, will be crossing his fingers, hoping that we can get through the really cold seasons. I've got to tell you, I don't know if you want to swap places, Coyote, but it's going to snow tomorrow, apparently. So it is going to get very, very cold here in the UK over the next couple of weeks. But hopefully we'll be able to escape those lockdowns that we are seeing across most parts of Europe at the moment.
Don't worry, Juliana, you've got this. Well, thank you so much for that update. It's been a pleasure speaking with you. Please stay safe.
Thanks, Coyote. Thank you.
Well, the World Health Organization is calling on wealthier countries with high coronavirus vaccination rates to prioritize sharing doses with poorer countries before giving them to children. The Global Health Agency said in a statement that the current global inequity in vaccine access means giving older people, other vulnerable groups, and health workers in countries with limited supplies their initial 2 doses of a vaccine and a possible booster before the vaccination of children. Well, here's more in the Global Update.
Global Update continues in Israel, where nearly 40% of COVID-19 patients are below the age of 12. According to the Health Ministry, officials say that of 6,505 Israelis currently infected with the disease, 2,574 of those are children. The announcement comes as the government launched its vaccination campaign for children aged 5 to 11 this week. Around 1.2 million children will be inoculated with 2 doses of the Pfizer vaccine over the coming months. Coming to Europe, the Netherlands, as infection rates soar among school children, many classrooms are empty. Between 7 to 8% of pupils at St. Laurentius School in Breda have officially tested positive for the coronavirus. COVID-19 cases among children under the age of 9 reached a peak since the start of the Netherlands pandemic of 120 per 100,000 inhabitants last week.
Visit our website, channelstv.com, for more updates and a better understanding of the pandemic, plus other stories, all at your fingertips. And there you see that story from the WHO, as well as sports, politics, business, and so much more. And that's the COVID-19 update. Thank you for watching. I'm Kayode Okikulu.